Good morning, good afternoon, everyone. Today is February 23rd. Thank you again for joining our New Hampshire COVID-19 Vaccine Alliance meeting. Again, for those who are new, our mission is to convene stakeholders across New Hampshire to promote vaccine confidence, support accurate and consistent vaccine messaging, and to foster coordination with the state's vaccine allocation plan. To do that, we're promoting public buy-in for the vaccines to increase immunizations rates. And second most important is to be able to act as a force multiplier to support both the state's communication allocation plans. Also to counter misinformation on the vaccines and to foster use of the New Hampshire's immunization information system. As always, I'd like to thank our sponsors for this event: Harvard Pilgrim Healthcare, Anthem, Derry Medical Center, Convenient MD, WellSense Health Plans, and NH Healthy Families. A couple takeaways. According to some public sources, supplies increased to about 40,000 doses per week. I've heard some mixed information, but that's the most readily findable information that's been reported. This is in part due to increased a federal partnership with Walgreens. Now you can't go to the Walgreens site. The state is identifying, contacting those who are already registered. And essentially they're pulling those from April that are in both phase 1 and phase 2. Phase B to move up to scheduled appointments. And we've seen a lot of that happen. A lot of cases have been resolved, updated in this past week. So the additional supply is helping move up those, all those delayed registrations. From last week also, it's important to make sure that anyone who is part of phase 1A, even the lowest risk healthcare staff, can and should register for the vaccine. And we want to make this push. We'll talk about it a little bit more in the next couple of weeks. Once we hit phase 2, then it's going to be more difficult for individuals in any part of phase 1 to get a timely vaccine appointment. There also is new labeling information that's available, and that for the Pfizer vaccine is that it is viable in normal freezer conditions for at least 2 weeks before use. And for the Moderna vaccine, it can be up to 30 days before use. And so that's a big change. And that will also probably help in allocation and distribution policies as we move forward. Phase 2 right now is anticipated to be late March or April as we begin to wind up phase 1. And this past week, we've been outreaching and working with school stakeholders. I have a call a little bit after this afternoon to talk to some of them. If you're interested in part of the school's population, please reach out to me. And we're going to try to coordinate those stakeholders and help make sure that the information is out there right now. So this week, what we're asking is for all healthcare entities, from hospitals to pharmacies to other kind of medical, anyone who would qualify for phase 1A, to urge them to register. The reason for doing this is the increased supply is going to make it so that we're pretty confident that anyone who registers in the next couple of weeks is going to be able to get their first dose in March. Since the origins of vaccine hesitancy are really diverse, you want to try to elicit the specific concerns and do so in a non-confrontational way. Also, we've learned that many clinicians will cite that their own colleagues' decision to be vaccinated. So those who have been vaccinated can be essentially those who can help promote the vaccine more readily, according to recent research. Now, the big difference is that the closed PON sites have largely been removed from most hospitals. And so it's only open pod sites. So you have to register now through the www.vaccines.nh.gov website to be able to do that. And so that's an important differentiation. On the other hand, it'll make it easier. We probably won't have some of the problems that we had earlier. We're also going to be working with some of the AARP and some other interests in the state to reach out to the 1B population, those over 65 years old or 65 and older. So to do this, there are some resources that have been developed. You're seeing here, it's both these resources we will put out on our website in MS Word .x formats, so that you can take these and use those, brand them for your own, but we highly encourage you using that. Next slide, please. In addition, you can pick up some of these talking points and toolkits are available at the maskupnewhampshire.com under COVID-19 vaccine. And that's the entire toolkit. So if you drill down, you can find all kinds of information from the new COVID-19 vaccine toolkit that's available. And we encourage you doing that and making it your own. Next site that's very, very good is the CDC vaccine site. And they have a toolkit, a little bit different. And again, just another take to take some of the best information that you feel would work with your constituents or staff. Another good site is the New England Journal of Medicine's FAQ site. They have a lot of the kind of the same information. And lastly, we'll put the talking points that are available in MS Word form out for distribution. So you can come into our new site and those will be available to be downloaded directly. But you can also find those in PDF and other forms. If you're savvy enough to be able to manipulate those, you can take those and move it forward. So a shorter meeting planned this week, if you can go back real quick, is that next week we have a couple different things that are happening. One, this week we anticipate that the Johnson & Johnson, the vaccine emergency use authorization process will begin this week. And so we should have a lot of new information on where that stands and how that is progressing with FDA approval. But thus far, the information looks pretty good. Also, we will try to work and have some guests from the Division of Public Health Services to talk about how they intend to use vaccine at other sites. There's been some discussion about moving into more open pods and using there's about 100 different groups, organizations who have requested vaccine distribution or completed vaccine distribution agreements. So what we're hoping to do next week is actually discuss a little bit more about what the timelines are to give you a little bit more lead time, what the state's expectations are going to be, and how you can begin potentially to plan or to reach out to the division to get more information. So a couple of big things starting to develop. We also anticipate that the 2A guidance will, if not available next week, my guess is it'll be the second week of March, but they'll want to get that out at least a couple of weeks and begin to start registering that 2A population. The biggest change is from that is the state intends to move away from the VAMS registration site to its own VMS that you'll see linked to that's part of the immunization information system. So that's a major change. And I'm sure in the coming weeks, we'll have more information about how that site works, how it's different from the VAMS, and how the state will make that work appropriately. With that, we can take on a few questions. Please use the Q&A box to ask any questions that you might have. We have one. Vanessa, I just wanted to ask if there was anything more that you wanted to discuss or to showcase about the new vaccine toolkit that you helped develop.
No, thanks, Jim, for the opportunity, but everything is on the website. And like you had mentioned, the entire toolkit is there along with the assets that are contained within, and people can download them and use as they see fit.
Great. So we have one question. It says, has there been any consideration of adding individuals with severe mental illness living in congregate settings to 1B? Given the spike in recent ED boarding and COVID-related complications. Not to our knowledge, but that's a great question that we can ask if the state is considering changing its definition of a congregate setting or long-term care setting, and how it might and how they might be doing that. There is the health equity distribution group. That's another group that we could have come on sometime in March and talk a little bit about what their efforts are doing. That program has been a little bit more slow in developing. We know that working with the Home Care Alliance and some others that we're looking into how can we distribute vaccine through some other channels, maybe not as efficiently as some of the larger open fixed sites, but still making sure that we reach those populations that are not able to get to those fixed sites very readily. So 2 questions here for the next one. We have an RN who is looking to work at either the Gove or Exeter fixed sites. Who should she contact? That's a great question. I would probably suggest that they reach out to the Division of Public Health Services. Or if you want to, you can email me that individual's name and contact information, and we can make sure that get it to those. It could be, again, it could be anyone from letting Terrain Hall or Daily know, but hitting one of those individuals if you're willing to do that. For the health equity process, they're still trying to work that largely through the regional public health networks. So there has been not as much responsiveness to the public registration site for volunteers. And so we've been directing, the alternative would be to go directly to your regional public health network to ask how they are or how you can be involved in that way. Second question, do you have any idea if and when vaccines will be available to those who are unavailable to get to the fixed sites? And as I mentioned earlier, we've been working with Gina Baucus in the division to see how we can use home healthcare agencies. So even that is somewhat restricted, is that you have to be receiving medical services. We've also been investigating how potentially to use not only that particular population of providers, but also how to use visiting nurses and also how to use EMTs. We've investigated, and Vermont has a little bit different program, but they're using EMTs to do that, and they have contracts to walk vaccine out to individuals who are homebound. So that's work is still in progress in discussions, but that would be clearly a population that would be part of the health equity distribution of the 10% set aside this particular time. So again, I'm sorry that it's a little bit shorter meeting this time. We're just been along. Again, the focus here is to reach out to all those in phase one, particularly healthcare workers, to urge them who've been hesitant to date to go out, and also make sure that you're capturing everyone in phase 1A. We had a lot of practices who called and said, well, can the other least risk or lowest risk individuals now get vaccines? That's been open for a few weeks. And so that clarification, please be sending all your healthcare workers to the vaccines.nh.gov registration site. They'll declare themselves as healthcare workers and move through the questions. But now is the time to get them, again, because of the increasing supply that we're seeing in the state. And we're about to pivot to 2A. So we think this next month is a really great opportunity to who those who've been hesitant in phase 1A and 1B to try to get registered. Question is there any way to schedule a qualified individual on a specific day? This came as a rare case recently with a patient on an immunosuppressive infusion. It might be able to. I think we would have to use this as an exception. Again, if you'll send us the information if this particular patient has already registered, or if you're attesting to them being medically vulnerable, I think the first thing that I would probably urge you to do is, however you can get them registered at this time, get them in the system. Then once we have that they're in the system, we have a name, their email address, what and when they have that first dose scheduled. And that's because I think they're pulling from the end of the list right now to try to move them up into March. So if you can help us identify that, then we can follow up with the state and see if we can get that potentially tailored to something that's local and on a particular date if need be. Okay, that's all we have right now in questions. We'd be happy to answer any more. Again, thank you for joining us. Next week, we'll have more information about the new J&J emergency use authorization, where that stands and what that means to allocation in the Granite State. I can tell you, talking about J&J, that the SDMAC, the State Disaster Medical Advisory Committee, did meet last Friday and discussed how best to use the J&J vaccine for about 2 hours. My sense from the discussion, although these are just recommendations and ultimately that DHHS makes the final determination, but J&J is not anticipated, at least initially, to have a great deal of presence in the vaccine market. And so because of the limited supply and because it is a one-dose regimen, that would be more effective for audiences like homebound individuals. Instead of having to visit them twice in a very labor-intensive activity, that might be a good case for utilizing the J&J. I meant to put up what Dr. Talbot last week in her presentation on Thursday at noon actually gave a nice a summary. And there is a little bit of what I would call vaccine bias going on, but based on the information that she had, it was clear that not only did the mRNA vaccines produce about 100% effectiveness in promoting severe cases and essentially limiting hospitalization for death, but that also seems to be true for the J&J vaccine. Overall, some of the numbers are lower. That has to do, according to Dr. Talbot, with how those trials were conducted, and it was in part conducted against both the Brazilian and the South African variants of the virus. So those numbers are a little bit lower at this point in general. And again, that's the threshold of not essentially contracting the virus in a discernible way. So that's the threshold that disappears when we're talking about severe treatment or hospitalizations or death after the 28-day period after the vaccine has been administered. So again, more information about J&J. We thank you. We look to have a lot more information, re-engaging our partners with the Division of Public Health Services in the coming weeks. There's going to be a lot of changes coming. So thank you for participating this week. We'll stay in for a few minutes to answer any possible questions that you might have. I hope you all have a great week, and please get out there and urge those hesitant healthcare workers to see if we can get them to register. Again, thanks for your time, man.